Transfusion services in a healthcare facility. Definition of transfusion services. It can be defined as a medical facility which is designed, equipped, staffed to procure, draw, process, store, and distribute human blood and its derivatives. This definition is given by the American Association of Blood Banks. All the functions of the blood services is given in this one statement. So, what is the functions of blood bank? First is recruitment of donors and maintenance of donors record in regarding to the blood group and antibodies, etc. Collection, preservation, and distribution of blood and the blood components ready for the emergency availability. And laboratory procedures like testing for hepatitis B, hepatitis C, HIV, VDRL test, malarial parasite test, etc., should be done within the premises of the blood bank. Teaching and training and research, if at all it is if at all a blood bank is a part of a teaching institute, they can in fact impart teaching and training in respect to the department. Clinical and therapeutic functions like transfusion, daycare services, etc., is given for patients who are suffering from like hemophilia, thalassemia, etc. Then we have organizing outreach programs for blood donation camps in the community on a regular basis, community awareness programs in close liaison with mass media for motivating the people to donate blood, awareness program for the treatment of hematological disorders like hemophilia, thalassemia, etc., community awareness program for transfusion transmitted diseases like HIV, hepatitis, syphilis, etc., and then maintaining the database for various blood groups along with the contact phone number and email ID, etc., especially for the people who have rare blood groups, etc. Location ideally should be located on the ground floor and must have a direct access from the main entrance. There should be signage system in place for easy visibility for the visitors. Then blood bank should be located close to the emergency department of the hospital and near the operation theater, between the emergency and the department and the operation theater. Facilities, physical facilities and space is the first one is the donor recruitment office, where it is the most vital activity of any blood bank. Recruiting voluntary donors requires a spread of public awareness through mass media and community approach. So donor recruitment space will have important health education pamphlets and liaison with mass media, etc. Then bleeding complex, it's a bleeding room, apheresis room, etc. will be here, reception, examination room to check the vitals of the donors, etc. Restroom, post apheresis is given in this area, bleeding complex. Then we have a therapeutic area where patients, in case of those who require frequent transfusion of blood and or blood components like patients with thalassemia and hemophilia, for them a special area is given so that frequent transfusion can be done in the blood bank itself. Then laboratory for processing the donor's blood and blood component, laboratory will have to prepare for the basic work, for example fresh frozen plasma, platelets, packed RBCs, leukocyte poor RBC, etc. These are the basic work done. Advanced work, freeze drying and heated coagulation factors and plasma fraction, etc. The advanced works done. And then donor serological laboratories, RH grouping, APO grouping, antibody screening will be conducted here. Then we have infectious diseases laboratory, which will check for testing for HIV, any malarial parasite, syphilis, HPV, hepatitis C. These tests will be done in infectious disease laboratory. Patient serological laboratory will be conducting special tests like RH grouping, antibody screening, identification of antibodies in positive screening, cross matching of the blood, antenatal checkups, etc. is done. in the serological laboratory. In administrative area, it will contain consultants, chambers, department office, staff's common room, washrooms for males and females, and housekeeping room, public relation officers room, etc. Those rooms will come under the administrative area. Then teaching and training facilities, if at all the blood bank is a past part of a teaching or training institute, it will participate in the teaching and training program in some hospitals. So it will have conference room, demonstration room, department library, reading room, etc. for the students. And other physical facilities will include water supply, electricity supply, sewage disposal system, the storage system, steam supply of distilled water, high pressure vacuum intercom system, and mobile van for conducting blood donation camps in the community programs. These are the few equipments mentioned in the textbook: blood bank, tube sealer, blood collection monitor, blood roller mixer, plasma extractor, freezer, refrigerator, cryo bath, plasma thawing bath, centrifuge, counterbalance, syringe needle destroyer, clevofuge, blood donor chair, blood donor couch, blood warmer, platelet incubator. So these are the more commonly used equipment that you will find in a blood bank. Then NACO will guide all the SOPs which has to be followed in all the blood banks across the country, National AIDS Control Organization. So under the Government of India, Ministry of Health and Family Welfare, it is the headquarters is situated in New Delhi. It has designed various procedures and step-by-step approach while dealing with any transfusion services of the hospital. So the students who need much more knowledge in this area can visit the website which is given here. It is www.naco.gov.in. So standards of blood bank and blood transfusion services, you can get a PDF on that and you can read through that. Then selection of donor and bleeding bleeding donor. The two main things you have to keep in mind is the safety of the donor and the safety of the recipient. These are the two aims which is kept in mind while selecting a donor. Then donor should have, the age should be about 18 to 65 years. Body weight should be around more than 50 kg. That is a standard which is used in India. And body temperature should be less than 37.5 degrees Celsius or 99.5 degree Fahrenheit. Pulse rate should be between 50 to 100 beats per minute. Blood pressure, the systolic blood pressure should be between 90 to 60 mmHg, and diastolic blood pressure should be between 50 to 100 mm of Hg. And hemoglobin estimation in males, minimum 13.5 gram per deciliter should be there, and in females 12.5 gram per deciliter should be there. These are the minimum hemoglobin estimation rate which should be followed. And specific gravity of the blood, it should be more than 1.055 in males, and in females more than 1.053. So these are the criteria which has to be followed for a donor. Deferral of a donor for donation of blood. Permanent deferral is done. In what circumstances you can refuse the person to make a donation of blood, and it can be either permanent or temporary. So in permanent, if a patient has a history of viral hepatitis, history of jaundice, or of unknown cause, any malignant diseases like leukemia, convulsions, or history of convulsions since childhood, fainting spells, abnormal bleeding tendency, and has a positive hepatitis B tested positive. So these are the drug addicts, people who are in high risk behavior. These are the permanent deferral cases. In temporary deferral, conditions require rest or medication, cold medication, flu, people who are diabetes, who are suffering from TB, sexually transmitted diseases like syphilis and other infections, and people who are with diseases of any heart, kidney, lungs, stomach, or liver, which is who are currently going through the diseases of these systems, but in the future they may come back to the healthy lifestyle. So temporary deferral can be removed in that case. So labeling and storage of donor blood. Donor blood should be stored at 1 to 4 degree Celsius in a proper blood bank refrigerator. Untested, tested, and cross-matched blood should be stored in separate refrigerators, and standard color labels are used for labeling all the donor units. Donor bag should bag number, date of collection, date of expiry, what is the blood group of the blood in the bag, and all the other relevant information should be mentioned in the label. Correct information is made available on cross-matched label so that blood goes to the correct patient. Then the test which is done on the donor blood is ABO and RH typing is done to confirm the donor's blood group and antibody screening. And it should be carried out in the donor laboratory. Every donor blood must be tested in infectious diseases in the laboratory for HIV 1 and 2, hepatitis B and C, syphilis, malaria, VDRL test is done. So blood bank must have separate facilities to carry out these tests in their own premises. And issue of blood bank, only an authorized hospital employee, doctor, nurse, or nursing orderly should receive the blood on behalf of the patient. Person receiving the blood and technician issuing the blood should sign the issue register. Blood should be transfused without any delay. All empty bags should be returned to the blood bank within 24 hours of the use. National Blood Policy. The government of India has published the National Blood Policy in the year 2002. So the objective of this policy is to provide safe, adequate quantity of blood components and blood products to the recipient. And the aim of the policy is to procure non-remunerated regular blood donors by blood banks to make sure that some monetary incentives are not given while donating blood. It should be a voluntary donation made by the donors through any blood bank, and there should be no remuneration attached to the donation of blood. Thank you.